Hi, I'm Bob Roth, Managing Partner and Co-Founder of Cypress Home Care Solutions. Since 1994, we've been helping older adults in the Phoenix community age gracefully and safely in the place they call home. Since 2014, I've been bringing you Health Futures, Taking Stock in You, a show dedicated to helping you live a longer, healthier, and happier life. Be sure to subscribe, rate, and review this podcast, and enjoy the show. Welcome to Health Futures. I'm Bob Roth. I'm your host today, and I have the luxury of having in the studio with me a longtime friend of mine, Dr. Heather Carter. Can I call you Heather?
Absolutely.
So Heather, your journey spans education, academia at ASU, public service in the Arizona legislature. That's when I really got to know you. Now you're in healthcare leadership as CEO of Health Choice Arizona and GM of the Medicaid segment of Blue Cross Blue Shield of Arizona. Few people have seen healthcare from many angles: classroom, capital, and community. Heather, welcome back. You have been a guest on Health Futures 4 times previously. Are you ready for this? First time. 4 times. The first time you were on with me was in January of 2017.
Been 4 times?
Wow.
Steve Jennings from AARP.
Yes.
And John Scott Williams from
right.
Fellowship Square in East Mesa. It was just the 3 of us. We did our show then. And then I had you on with Crystal Wilkinson, one of my colleagues from Adult Care Assistance. That was in July of 2018. And both of those times you were in the Arizona state or U.S. representative. State U.S. representative.
Yes.
Arizona state legislature. And then I had you back in 2019 with Brian Hummel and Nicole Homestead, both from the American Cancer Society. And then I actually also had you in July of 2020. It was just you and me during COVID.
In
the middle of COVID. In both of those segments, you were Arizona State Senator.
Yes.
So you were Arizona State Representative and Arizona State Senator. So your career, and I learned that you used to sell air. I didn't know that. You used to sell air. You were radio lady. Cool. That's right. It was cool.
Yes, air.
Radio was really cool.
Radio was cool.
And we used to do radio.
Cool
now
radio.
We're doing podcasting.
I love it.
How cool is that?
I love it.
And I also learned that you worked for the Suns.
Yes.
And, you and I share something in common. So you were part of the academia at ASU, and presently I'm on the advisory council for the ASU HEAL Lab, the Healthcare Entrepreneur Accelerator Lab.
Love that.
And that is part of the Edson School of Nursing and Innovation at ASU. So really, really cool thing. So
love that.
It's great to have you back, but it's hard to believe it's almost 6 years.
Here.
No, we're not. And you
but
and
I feel teenagers.
We ran into each other.
We're not getting any younger.
Like you said, it was a year ago.
I feel like we're still.
And I said I had to have you back on. And so I am really glad to have you back on.
Thank you.
So I kind of gave a little background. Did I miss anything in terms of teeing up our session here today?
Well, I always like to say that nothing prepared me for my professional life like teaching middle school. So whether it was the legislature, whether it's in my current CEO role, I really drew upon my experience as a 7th grade teacher in so many different ways. And just a big shout out to all the teachers across not only Arizona, but the United States. You really are the lifeblood of our community. So 100%. I love my experience as a middle school teacher.
And I will second that and also say right behind our teachers, or maybe right in front, are our caregivers.
Absolutely.
The people that are making ultimate sacrifices, especially family caregivers that are helping their loved ones through their journey in life. And that number, believe it or not, is up to 63 million people.
Wow.
And approximately 17 million of them are caring for someone that has Alzheimer's or dementia, which makes it even harder. But I'm really glad that you talked about education, because my first question was going to say, you started as a teacher, right? And I wanted to know how the classroom really shaped you and prepared you for leadership and what you do today.
Well, when you stand in front of middle school students day in and day out, There is nothing more authentic and real than trying to get them engaged and passionate about any topic. I happen to teach English and social studies, and so really trying to get that fire and that passion across to them so that they are inspired to learn is something that is difficult to do.
Sure.
But when you see that spark in a child's eye, I actually saw the future. And when I looked out across my classroom, every single child in that classroom had such a unique story and experience that they brought to the classroom that I tried to use that to help them then connect with the curriculum. And so I felt like I was shaping the future every time I was able to stand there in that classroom.
I love that. And you were in the PV school district.
I was.
And which school, if you don't mind asking?
Greenway Middle School.
Greenway Middle School, wow.
Absolutely.
And middle school, I mean, it's all about survival. That's what my elementary school teachers told my daughters, or at least us about our daughters.
Yeah.
You got to survive middle school to get to high school.
Yeah. And middle school, as middle school teacher, it takes a special, I think, passion for that adolescent age, because this is really where they're going to start to figure out what they're going to do with the rest of their life. They may not know it, but this is where they start to explore different topics. They might do sports. They might do the arts. They might be really passionate about math or a foreign language. And so this is a chance for them to try all sorts of things, hopefully good, but we know maybe there could be some bad sprinkled in there. We hope less bad than good. But that's really where a lot of the foundation is for their future. So I think it's important for us to just remember that as kids are really navigating their daily world, we have an opportunity as adults to support them in any way possible.
I love that. I really do. And like you said, you got to connect with them.
You have to connect.
And their minds and their bodies and souls are just growing, and they're like sponges.
And you get to help them connect A to B. So if they're interested in A, let's say baseball, for example, how can you use baseball to translate that into mathematics?
Interesting.
I did not teach math, so that's not an example from my classroom.
No, but baseball, when it comes to statistics, I mean, it's a natural progression in terms of marrying math to baseball.
Exactly.
I love that. So when you talk about education, you know, you also were in the academia world at ASU, and you had a deeper role at ASU, far deeper than many realized and that I realized. And across education, nursing, and health innovation, when did you see the connection between education, health, and really long-term outcomes really click for you?
Well, what's interesting is I transitioned from the middle school classroom into teaching teachers first. So I had the privilege of teaching over 180 to 200 students every semester who were starting their journey on becoming a teacher.
Right?
So that was my first sort of job at the university. I was a lecturer.
Teach the teachers.
Teach the teachers. And when I realized what an impact teachers had on the future, I realized that I could expand that impact by giving tools and tools and tricks and tips to future teachers to help them connect with their students. And what's fascinating is watching those teachers that I supported at that original part of my career there at ASU, watch their career trajectory. I mean, they're approaching 20 years in the classroom now, which is absolutely amazing.
Some might be assistant principals and principals.
Oh,
too.
Absolutely. Absolutely. They might be leading, whether it be a school or a district and beyond. I received my doctorate in education leadership in 2006. So really moved into more of a leadership role by helping organize the Teach for America program here in Arizona. We had over 100 new, what they call Teach for America core members. So I was able to really get to know not only the Teach for America program, but so many other districts across the state. And where I really made the connection between education and healthcare was not only in my role as a middle school teacher, but watching my teacher candidates navigate their experience in the classroom. And I think it's safe to say everybody realizes that if a child shows up in a classroom hungry or tired, or they don't have the appropriate clothes or supplies that they need in the classroom, it's going to make learning that much more difficult. which is no fault of the child. So if we can address some of what we called social determinants of health, then that transitioned to health-related social needs, and now they're changing the title of it every day. If we can address some of the health conditions that show up in the classroom, we can remove those barriers to that child realizing their full potential, whether it be hearing, eyesight, whether it be hunger, housing, transportation. All of this shows up in the classroom. And so if you want to give the child the best chance at their future, you've got to help them solve for some of these health challenges that they may face that is not their personal responsibility.
Right.
It could be either the community that they live in, could be some of the challenges that their families face financially. So I just see that as core to education success, addressing the health challenges for the kids so they can learn.
You know, it's interesting the way you describe that, because I think, the mindset is people see teachers as just teaching.
Right.
But you're
more.
really looking at the whole person, the whole body.
Exactly.
And to make sure that everything is in check so that they are ready to learn.
Exactly.
Because you want to give them the chance.
Exactly.
And that's what we need. That's our future. These kids.
It is our future. The future, the children that are sitting in the classroom today will be the caregivers, the nurses, the physicians, the eye doctors. The list goes on and on
Right.
of our future when we're older. And so I feel like we're giving back not only to their future, but to our success in old age as well. We want an educated population so that we have a thriving community, no matter what they choose to go into. I, of course, am very passionate about the healthcare delivery system.
Me too. And I certainly know that I'm going to be a customer one day. So I got to certainly.
We're all a customer right now, but we're going to be more of a customer.
Exactly. I want to make sure that we have the resources and the people and the policies in place to make sure that I get the care that's necessary. So policy, perfect segue to talk about turning ideas into action. So during your time in the legislature, you championed Medicaid expansion and KidsCare. Looking back, what decisions are you most proud of, not politically, but from a humanity standpoint?
Oh, wow. It's a
deep question.
That's a deep question. I think I'll first focus on my foundation in my role as a public servant. I really see elected officials as public servants. I think that concept is lost perhaps in today's day and age, that people run for office because they're passionate about something. I was passionate about education. I was passionate about healthcare. And at the end of the day, figuring out how you're going to pay for everything that you want to do. But what I realized really quickly, day one down at the Capitol, and you're just learning what it means to be a lawmaker, what it means to be a representative of the people, I didn't have all the answers. So the most important decision, which was foundational, was to always have that humble perspective of I did not have all of the answers, and I needed to find the people who did and then trust the experts. And so I really spent a lot of time networking and meeting people to figure out if I had a question about, this is what I always use as an example, fluoroquinolones and whether optometrists or ophthalmologists should be the sole prescriber. Obviously, that's not in my background, in my experience, and my training. I bring my own unique experiences and training to the Capitol, but I don't have all the answers. So I made sure I found people who had knowledge in whatever area it was that I was focused on so that I could draw upon that. But at the end of the day, I voted on bills, everything from tow trucks to air quality to education funding to Medicaid. And so you figured out what those areas were that you were going to spend a lot of time getting to know yourself and then building that network around you to be able to support you to make the best decision for the people of Arizona.
Well, and the thing I loved about you is that you were so passionate about
very passionate.
You didn't lack passion, and look, you had a full-time job,
right?
Beside
I was still
this.
teaching,
and you were teaching, and you were fully engaged. I mean, I met you, years ago. It was more than 10 years ago, and we tried to create some legislature for our in-home supportive care service side. And I knew I had an ally in you, and you helped me really learn how to work the legislature. Yeah. Because, I think most people go in there and they're scared to death.
It's a skill.
But they don't realize that our legislators are humans just like us.
Right.
They put their pants on the same way, their shirts on the same way. They go to the bathroom, brush their teeth. They do everything we all do. And they do have hearts. You just need to figure out how to connect with them.
And it's really building that relationship. And what I think is the most effective thing that you can do if you're trying to advocate for something down at the legislature is to connect whatever it is that you're passionate about to something that is of interest. Just like I was talking about in the middle school classroom. Find out what is of interest to that individual serving. Maybe they care a great deal about tax policy. Maybe they care a great deal about public safety. Maybe they care a great deal about education. Figure out what their passion is and connect what you're trying to advocate for to their passion. Or connect what you're advocating to something that they would be responsible for representing their constituency. So when you talk about caregivers, for example, this is a great story. If you don't mind, I'm going to bring it full circle.
Let's go.
I remember that so clearly. What we were trying to advocate for increased background checks for caregivers going into the home.
Right.
And as you know, you mentioned the startling statistics. I am a caregiver for my mom. She was just newly diagnosed with Alzheimer's. And I don't know if I had told you that prior to this. So newly diagnosed with Alzheimer's. They actually think she's had it for up to 15 years, which is shocking.
And by the way, in 2020, 2019, because 2020 we did it remote.
Right.
2019, when you and I did our show together, you brought your mom.
Yes.
With you.
Exactly.
And I remember you said she's out in the car, and I'm like, no, bring her in.
Well,
bring her into the studio. Don't leave mom in the car. Yeah. Let's bring her in. And you brought her in, and she was a delightful lady, a delightful person to meet, and my hat's off to you.
Well, thank you.
Because being a caregiver is not easy.
It's not easy.
And especially with an Alzheimer's diagnosis. Yeah. Bring me up to speed. Where's she at?
Well, she's already called 5 times since we've done this interview. Can you believe that?
I can believe that.
She's literally called 5 times.
I saw you look at your watch and your phone.
Right, and my phone. You might have heard the phone ring. That's my mom.
But that is a daily.
That's the daily. She probably, when her Alzheimer's manifests as severe anxiety, and when she's having a bad day, she can call me between 25 and 35 times a day. Yeah.
And where is she living with you?
She is living in an apartment right next to my house, so it's just the equivalent of living with me. We don't have a setup for her in my home. But I manage, it's a full-time job. I manage her caregivers that come in. I manage her food. I pay for her rent, her electricity. I manage everything. I mean, I'm a full-time caregiver for my mom. Only child. She's an only child. So it is, all the pressure is on me. But back to that bill that you were advancing in the legislature was around having reputable people coming into the home.
100%.
And I hate to report, but my mom had a caregiver that stole $440 that we had to file a police report for.
Thank you.
I am so passionate about making sure that the people that show up for our most vulnerable population are at bare minimum a security background check of some sort.
Right.
And that is not in place today. And yes, we went through another, a different agency via the state, and unfortunately, we had a negative experience. So now I have to be even more hyper vigilant about who comes in the home. I know you do an amazing job on this.
No, thank you. And this is a hard thing. I mean,
it's hard.
Here we are. We're talking about our state government, right? And our state government does not have regulations.
Right.
And trust me, you and I shared some of the same political ideologies.
Right.
But at the same time, when you're talking about one of the most vulnerable populations, we need to be able to have some type of guardrails to protect this population. And how do we do that? We need some legislature.
Right.
You know, we were able to pass that one bill.
Yes.
And it was passed in 2014 and signed into law by Governor Ducey.
Yes.
And basically, while it's not perfect, and you and I talked about this, it does give us at least some type of semblance of, teeth.
Right.
And when I say teeth, it requires, standards that need to be followed.
Right.
It requires disclosures that need to be made, because otherwise we are in the wild, wild west, leaving these vulnerable adults where a caregiver who enters the home when that care recipient opens the door, they open their life to them. And in your situation, being an only child, having really your children don't live here, and who is watching your mom when you're working
full time?
Who's going to be there? You
Right.
need to make sure that person has been, background checked, vetted out, trained, make
Right.
sure that they have the skill sets and the tools to do the job.
And you have been such an advocate for this type of structure in place to protect the most vulnerable. I just want to
thank you.
say thank you for your advocacy. And what was really important in that whole process is that you brought the content knowledge to the legislature, and you were willing to listen to those who work in the legislature to figure out how to make it happen. And so sometimes people would come to the legislature and say, I want to pass this bill, and it has to be this bill, and the language has to be this way, and we can't change anything. But you rolled up your sleeves and listened to, well, we might need to change this, we might need to soften this, and we need to get a vote over here, so we're going to have to modify this. It's all about this idea of collaboration and finding consensus on things that we can agree. Like, just the spirit of that approach is what is so desperately needed in today's political environment, and I don't see that, to where it doesn't matter which side of the aisle you're on, everybody will be faced at some point in time with something related to health. Hopefully you manage to escape this life without needing a caregiver, but odds are you won't. No. So being an advocate and bringing those sort of situations to the Capitol is so important, so we can make sure that we have the statutory mechanisms in place to make sure the good actors are thriving and that we keep the bad actors out. But you didn't come in and say, it's got to be this way or the highway. How many years did we work on that? 4 or 5 years?
7.
7 years.
7 years. It was before you even got into the legislature.
We never, ever gave up.
We never gave up. And, I learned a lot.
Right.
And while we were doing good,
right,
and we were trying to help some of the most vulnerables in our
right.
communities, I was shocked to see how much, let's put it this way, people that were adversarial to me.
Yes.
And in the legislature. And, I, as you recall, not once, I went through 3 different sunrises.
I know.
And going through the sunrise process.
Guess what? I think they've gotten rid of the sunrise process, which is crazy.
And I think my last one, I think you were the chair.
Yes,
yeah.
I was.
And I loved how, I approached you and said, Madam Chair, my name is Bob Roth, and I'm the
As
owner.
if I didn't know who you were. But it's all recorded. So,
It is all recorded.
Right.
But I remember, and I won't call this person out, but
right.
this one person
right.
who just used her microphone to, and now we know it's a woman,
right.
to really speak up against. And
right.
I'm like, I don't understand. How can you be against this?
Right.
How can we not protect one of our most vulnerable
right.
populations? So we made progress.
We have to take progress where we can make progress.
Yeah, we're not still there. And, I learned from Stuart Goodman, who both of you and I know,
yes.
who's a lobbyist and public affairs genius, if you would.
Absolutely.
He told me that, it takes years to put
yep.
a really good bill
yep.
in place. And the fact that we got this one
right.
is something we could build on maybe down the road.
Absolutely. And it's like building a house with bricks. You have to lay the foundation, and then you have to place brick by brick by brick to finally get the finished product. And just thank you for your advocacy in this space.
Well, thank you for the work you did at the legislature. Yeah. So here we are, you are now in healthcare.
Yes.
And when you left the legislature, I think, if I recall correctly, you served on a couple of not-for-profit boards. Mm-hmm. And then, next thing you know, you're doing Medicaid. So I really want to dig a little deeper into this.
Yes.
And what do you want people to really understand, especially here in the state of Arizona, about Medicaid and about Health Choice Arizona? And what do they often get wrong?
Well, I think there could not be a more important time for us to be talking about Medicaid. You can watch the news all day long, and you can hear the sound bites, the 8-second sound bites, the newscasters reporting it's doom and gloom. Mm-hmm. But if I want to take one talking point that I want to make sure that I get across to everyone listening, Medicaid is alive, it is well, it is functioning, and you are still able to enroll in Medicaid services. And obviously there are different populations, there's different eligibility limits, but a lot of people with the talk of the passage of HR 1 and just hearing all the forthcoming changes.
And for people that don't know what HR 1 is, it is
the One Big Beautiful Bill.
BBB, right?
BBB, One Big Beautiful Bill.
HR 1.
3 cubed. There's lots of names for it.
There you go.
That when the federal government was debating the One Big Beautiful Bill, Medicaid was at the forefront of that conversation. Obviously, the health exchange was also in the conversation, but I'm talking just about Medicaid right now. And so many people thought that when that bill was passed, that Medicaid was completely cut, that it was done. And what we're seeing is a decline in the Medicaid enrollment for a variety of reasons. Happy to give you my crystal ball on why I think that's happening. But at the end of the day, you can still enroll in Medicaid. And in Arizona, I spent my professional career, I basically put my Republican professional career on the line advocating for Medicaid restoration and expansion in
100%.
Arizona. I am proud that we got it passed, and the hundreds of thousands of people that have received coverage since then are grateful for that passage. And then second to that was passing KidsCare, which is our CHIPS program. So anybody who is under the age of 20 is able to get care through our KidsCare program. What I want to say now, if you don't mind, Bob, I'm just going to take a little bit of a rabbit hole here.
Please go.
People are losing their Medicaid coverage for a variety of reasons. Some of them for good reasons. They got a job, they are employed, and they're no longer financially eligible for Medicaid. But because the KidsCare eligibility is at 225% of the federal poverty level, if the parent has lost their Medicaid coverage, their children may still be eligible for KidsCare, and they don't know they need to reapply to keep their children coverage. And KidsCare is phenomenal. It provides child visits, hearing, vision, dental. It is a phenomenal program for kids. And when I see kids in schools going without health care, it just makes my blood boil.
100%.
And we have so many kids, and today I'm trying to take this full circle, and I hope this is making sense.
No, it is.
I worked in a school where I had 98% of my kids were on free and reduced lunch. The majority of them, English was a second language.
Wow.
That if they knew back then that they were eligible for KidsCare, I could have solved so many problems in my classroom. Kids could have received eyeglasses. They could have had hearing tests. They could have went and received their vaccinations to be eligible to go back to school. If they were sick with strep throat that turns into pneumonia. I've had all these stories of kids in my classroom. So my two talking points for today's podcast is Medicaid's alive and well. And number 2, if you are no longer, as an adult, eligible for Medicaid, and you have children, your kids may be eligible for KidsCare. So I hope people can take that as a takeaway.
No, I think it's an important takeaway. And we even have gone even further where they've created a parent CNA program for medically fragile kids.
Exactly.
And part of it is because we have a workforce challenge.
We have a tremendous
And you think
challenge.
about how many single parents are out there raising children.
Right.
And if you have a medically fragile child and your caregiver doesn't show up, you can't go to work.
Exactly.
And many of these children are on vents.
Right.
And they need somebody that is skilled in that area to be able to do that. So the state has made accommodations for these things.
Yes.
And the reason why we are able to do that is because we have an advocacy group.
Yes.
We have come together and, like you've said, collaborated. And I know a number of home healthcare companies that engage lobbyists, and we're working with the legislature to try to get these things approved.
Right. And it really makes, this gets back to being a strong advocate. Obviously, you and I can debate and advocate for the health benefits, but it also makes financial sense as well. There's an economic impact to having a structure in place where people can stay employed and engaged in the workforce and have the medical coverage and caregiver needs that they have for whether it's a medically frail child like you're talking about or an elderly parent. I can make the economic argument all day long for these policies in place. So this is where it's really important for the entire community to come together and work to share those stories, try to connect it to the individual lawmakers' either personal experience or to constituents that they may represent, and then figure out what is of interest and of passion to that individual person. Maybe it's the human story, maybe it's the financial story, because you can actually advocate from either position.
And we can talk about the human story and the feel-good piece.
All day long.
But the financial story and the piece that, I know you didn't deliberately leave out, but if that person can't stay at home, where do they go?
Right.
They go into a skilled nursing facility.
Exactly.
And what does that do to health plans?
Right.
It drives up the cost.
And it's not necessarily the best thing for the individual.
They don't want to be there.
And at the end of the day, you need your healthcare facilities, whether it be a skilled nursing facility, on a hospital emergency room, available to take care of the people that need that level of care.
Right.
But if you're showing up, for example, in the emergency room with strep throat, what does that do for the next person that has a heart attack? And now you don't have a bed available because the emergency room is filled with people there because they just need maybe general practitioner care,
right.
But they don't have the insurance or the coverage.
They don't have the insurance, so they use the ER as their primary care.
We called it the hidden healthcare tax when we were doing Medicaid restoration, because that expense gets shifted on to the entire rest of the healthcare delivery system. 9 times out of 10 into your insurance premium, because that you have to pay for the physician and the nurses and the entire team that comes up that is available to take care of you at the time when you need it the most.
Earlier this month, I had Todd Laporte, who's the CEO of Honor Health, on.
Fantastic healthcare leader.
And he is an amazing healthcare leader, but he talked about the tens of millions of dollars of free service that they have to give away.
Right.
Because people are using their ERs as their primary care.
That's exactly right. This is taking it full circle.
Yeah.
We want people to be healthy so that they can lead not only, economically viable, but abundant lives. And the more we can give those type of supports to people so that they can participate in today's economy, the better off we all are, because it really is a community approach. And we have a tremendous healthcare workforce shortage in Arizona in some really key particular areas. And so imagine somebody who is working in the healthcare industry that is an individual caregiver that now needs to stay home to care for either a child or a loved one. Now you've just impacted their patients' lives because they're no longer able to work that day for whatever reason.
Right. Well, I think it's a great segue for my next question.
Okay, here we go.
All right. So with workforce, given your background in education and healthcare, what worries you most about the workforce? And what gives you the most hope about the workforce?
Boy, those are really two connected but completely different.
But what's interesting is, you talked about being a teacher in middle school. Right. And we need to empower our teachers. And look, we talked about the legislature. Right. And you and I recall, it was probably about 7-8 years ago, Governor Ducey was our governor, and the teachers marched. Oh, yes, I was right there. I have pictures in my phone. I think it was 50,000.
70.
70,000.
Yes.
Okay, 70,000 teachers went on strike. Kids had to stay at home. Yep. And there was a lot of unintended consequences that happened as a result of that. Absolutely. Medical emergencies, people died because nobody was, parents couldn't be at home because they had to be at work and their kid was at home. Right. So a lot of stuff happened. But they had 70,000 people march on the Capitol. Caregivers. Right. They can't. Right. They don't have a voice because if they leave their care recipient most likely could not be here today if my caregiver was not at home with my mom right now. 100%. Caregivers are the lifeblood of our community, right along with teachers. I'm so glad you made that connection. So what makes me
Worried.
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 And
I'm going to
gives you
start with
great
worried,
hope.
and
Yeah.
I'll end with on a positive. What gives me great anxiety and I'm concerned about is the caregiver burnout and the healthcare provider burnout. These jobs are very, very taxing. I'm part of a community called the Wellbeing Collective, and I've given some talks there and helped them navigate the advocacy space. And at the end of the day, imagine I inspire a 7th grader to go into medicine, whatever path that individual decides to choose. They work relentlessly through their K-12 education to get the grades, to get into college, to get into whatever advanced degree program. They end up out in the workplace and they last 3 to 5 years. The same can be said for teachers. Mm-hmm. The teachers, caregiving, these public-facing service jobs are exhausting. And so we have not solved for that problem yet. I hold out hope for ideas. I think there's a lot of new, and I don't want to say new, there's a lot more openness to talk about well-being and to talk about what you can do to regulate your own nervous system, to take time out for yourself, to talk about your own mental health. I think that is a new conversation in the healthcare space for providers themselves. Mm-hmm. That we just started talking about that when I was in the legislature, and we're just starting to see some advocacy and some legislation around giving space to have these mental health conversations. So I'm hopeful for the future, but right now it's a little bit of a firestorm.
You know, it's interesting. You talk about providers, and sure, you know, Cypress Home Care Solutions is one of those providers, and we tried our best to be able to work on caring for the caregiver, giving them the respite, the tools. You know, they care for somebody and they help them through their journey of life, and then all of a sudden the person either gets put into a skilled nursing facility or passes. You know, people don't realize the connection that caregiver has made, even though they're not family.
Absolutely.
They're affected and they grieve, and we need to be able to help them. So we're talking about the provider side. But we did open up talking about the 63 million Americans that are making the ultimate sacrifice, and the 17 million or so that are helping a loved one through the dementia Alzheimer's journey, like you are going through with your mom, and how stressful that is, and how you need to be able to find that balance, that way to be able to, you know, recharge your batteries to get the respite that you need. And that's why you do have caregiving. But we need more resources out there. And that's why I draw the parallel to the teachers. You know, they can throw 70,000 people at the legislature. And we at Cypress Home Care, we have a trade association called the Arizona In-Home Care Association, ASNAHA.
ASNAHA. That's a mouthful.
It is a mouthful, but I will tell you, I mean, I invited you to come speak to like 200 of us, and you were on the firing line, and you were so good.
Oh, thank you.
And the reason why you were on the firing line was back then the Medicaid cuts were just one year after another, and providers like us, we couldn't find caregivers to come work for the amount of money that we were being reimbursed for.
And they're coming again, unfortunately.
Oh, yeah, they are. And it's,
I mean, it's a reality. If we don't talk about it, we can't pretend. Well, you know, it's going to be.
There's no money in the budget.
Yeah, I mean, at the end of the day, money doesn't grow on trees when you're talking about, you know, the political environment. And so I say this to the incredible team that I have the privilege of working with at Health Choice inside Blue Cross Blue Shield of Arizona. We're managing state taxpayer dollars because that's where the money comes from, and federal taxpayer dollars. So at the end of the day, we want to make highest and best use of the dollars, and we want to make sure that we're delivering the services in the best possible way we can in partnership as a contracted entity of the state of Arizona. But at the end of the day, there's not unlimited funds. And
There's
so we
not.
have to have a community conversation of where do we spend those dollars. I personally think caregiving is a great place to spend the dollars for all the reasons we talked about and even more. But at the end of the day, like you talked about when it comes to well-being, we are going to have these financial pressures, but we're still going to need caregivers, and they're going to need to show up in the best version of themselves that they possibly can to serve the people that they are taking care of. So I personally, if you don't mind, would love to just share my personal story.
I do want to hear it.
You know, during COVID, obviously, everybody took up something, I think. They took up cooking, they took up maybe playing guitar. I had always taken yoga. I'd always done yoga, but I did my yoga teacher training and then moved into another program called Inner Alignment for healing the root cause of childhood trauma. And it was the most amazing program. It was, actually, it was 2.5 years. And Bob, I don't know if you know this, but I spent 2.5 years not only doing my own 8-week program, but then learning how to move into a coaching space and then learning how to move into a healing space. And so the tools that I used personally and then worked with several other clients of my own, I bring not only to my place of employment, where it's really about compassionate listening, it's about asking good questions, it's about being intellectually curious, and then giving that person that I'm working with the tools such of how do you take a 2-minute breathing break? How do you set intentions before you head into a meeting? Maybe as a caregiver, how do you set intentions for going into caring for a loved one on that day? And then what do you do to recharge your own batteries
I love it.
at the end of the day? And I got to tell you, I by no means am perfect, but I every day at least have an awareness of when I'm off balance and how that affects my mom, how that affects my daughter, how that affects my husband, how that affects the people that I work with. And it's my work, and it's never done, but it's my work to regulate my own nervous system to show up in the best version of myself I possibly can each and every day. And I am not perfect, but I have an awareness of where I need to do more practices to get aligned. That's been my work for the last probably 5 years.
I love
6
it.
years.
Well, you know what? It's crazy because you and I are very aligned.
Yes.
I'm a yogi. And
I don't think I knew that.
yeah,
Wow.
I've been practicing yoga for about almost 8 years now.
Wow.
And really was into it prior to COVID and then big time during COVID and then coming out of it, COVID. I mean,
That's amazing.
I need to get back to 5 to 6 times a week,
Yeah.
but I'm doing like 2 to 3 now. But I mean, it was an essential part of my daily life. I would do a 6:00 a.m. class.
That's amazing.
And by 7 a.m., I got my first win of the day.
Yeah.
And, you know, you talk about mind, body, and spirit.
Mind, body, spirit.
I mean, you know, look, meditation, breathing.
Breathing.
You and
Breath.
you and I were talking about, you know, our backgrounds and,
Right.
and being from Baltimore. And
Yep.
before we got started, you being from Montgomery County, and I told you I played lacrosse.
Yes.
I played football and lacrosse, high school, and then I went on to play in college.
Yeah.
I didn't know how to breathe.
Isn't that the truth?
And oh my gosh, I could have probably been a better athlete. I
Yeah.
mean, because I was breathing very short breaths. I wasn't
right.
really in touch with my breath. And,
Exactly.
and breathing is so important, and it can calm so many different things that are going on in your life and
Yeah.
give you a chance to put things in perspective.
I mean, you can talk about it from the physical body, the physiological body. You can talk about it from the mental body, right?
100%.
And imagine if we were able to inspire the next generation while they're in school, how to use their breath, how to use just that reset of taking, okay, I'm going to just take a moment. I'm going to close my eyes. I'm going to touch the table, feel the chair, put my feet on the ground, to give them those tools that they can take not only through school, but into their workplace and into their home. We'd have an
100%.
entirely different world today.
100%.
We have to do another podcast on this. Promise me we'll
will.
do another podcast on this.
We will, and I will tell you, you know, as we get older,
Yeah.
especially, you know, men, you know, trying to fall asleep is really hard. and actually, you know, going to sleep is not always usually the hardest. It's staying
It's
asleep.
staying asleep.
But I will tell you, one of the things I figured out years ago was if I put my mind to breathing,
Yes.
and I yoga breathe,
Yes.
I mean, I'm out in a minute or 2 minutes. I
Yes.
just concentrate on my breath.
Yep.
And I think if more people did that, they would be able to live more successful and happier lives.
I did a whole series of videos, and I might go back to doing them again. And they're on my LinkedIn channel, and I know we're going to post this on LinkedIn.
Yep.
So if anybody's watching this, you can scroll way back in my LinkedIn history. Might even be almost close to 2 years ago, where I talked about some of the work that I was doing in my professional life just to regulate my nervous system. And one of them, you're walking into a high stressful meeting, and how do you just take 2 minutes to not only calm your breathing, like slow your breathing down, lengthen your exhale, but set an intention? Game changer, just absolute game changer professionally. I'm using that now with my mom, and I'll be really honest with you. It's hard. I mean, I'm not telling you or probably any of your listeners anything they don't already know about caregiving, and then add in the complexities of Alzheimer's. I really watched my interaction with my mom. She became almost a mirror to my nervous system. So if I came in dysregulated into her house or preoccupied, AKA last night, it then impacted my mom, and then she would become dysregulated herself, and it became a snowball. So somebody in that relationship, which obviously it's going to have to be me,
you, yeah, 100%.
Needs to reset. And so I would love to have a whole other podcast and talk about the strategies that I'm using that. But I'm telling you, but it can show up. You can do that in the classroom. You can do that at work, and you can do it in politics. I've actually toyed around with an idea of how do you help people become, I'm going to say, grounded and have a regulated nervous system when you're talking politics. Instead of, think about when you start talking with politics with somebody you disagree, and that anxiety, and then your heart rate starts racing, and then you just start lashing out at each other.
Yeah.
And sometimes it's on social media and it's via words and videos. Sometimes it's actually in person on the street with a camera in your face. I think this is a great skill that you can take into any corner of your world, and we're all going to be better off.
Yeah, and I think we need to calm it down.
Yeah.
I mean, the rhetoric.
Take a breath.
Yeah, it's amazing where politics have gone.
It is.
And I share this sometimes. My friend Val Medeiros, who passed away about a half a dozen years ago, I'll never forget. We were in the Mayflower Hotel, which is one of the oldest hotels in Washington, D.C. I think it was built like in the 1800s. And we were sitting at the bar, Val and I, and this is like, I'm going to say this is in like 2011, 2012. And he said to me, he goes, Bob, back in the 1980s, I used to be here in the early 80s. Yeah. And sitting at the end of that bar there was Ronald Reagan and Tip O'Neill. Exactly. And it would be a Thursday night, and both of them would have a scotch or whiskey in their
100%.
hand, and they would be working out the challenges that both parties have.
Absolutely.
It's so divisive today, and it doesn't need to be. And I think some of the techniques that you're talking about can help us really have some very thoughtful, meaningful, intentional conversations and help work to resolutions.
Exactly.
I think there's a whole podcast here.
There is.
There definitely is.
And maybe even a book.
So I do want to say this. You went from selling air on the radio.
I love that, selling air.
Cool radio.
For Cool FM.
Cool FM.
Selling cool air.
You worked for the Suns.
Yes, I did.
The Phoenix Suns.
During their championship season, I might add.
There you go. Did you get a ring?
No, we lost to
But didn't
the
you
Bulls.
didn't you get one for winning the conference? No, they didn't give you one. Oh, darn.
I need to make my own.
That's right. Yeah. What was that, 94?
93.
93.
Yep.
And then you went to teach middle school.
Actually, I sold real estate in between.
Oh,
there.
yeah, you did.
I sold real estate.
So real estate, middle school. You went and became a doctor. You worked at ASU. You taught teachers.
Yep.
You worked in the legislature as a state representative as well as a state senator. You worked with not-for-profit boards, and now you're the CEO of Health Choice Arizona, which is part of Blue Cross Blue Shield.
Yes.
How do you do this? I mean, it's an incredible trajectory that you've been on. I mean, you have a really big job now. Not that the others weren't big.
No pressure.
No, not that the others weren't big, but now you're responsible. How many lives are you responsible for right now?
We cover just under 200,000 lives.
200,000 lives. That's amazing.
Yeah.
My hat's off to you, Heather.
Thank you.
You've had an extraordinary career, and I know
I appreciate
it's still going, and
Yep.
and you're a full-time caregiver.
Full-time caregiver.
So I want to conclude our get-together here, and I didn't really prep you a whole lot by just saying, hey, I want to do a rapid-fire,
Okay.
quick response. So
Okay.
I got a few here that I want you to give me quick responses
I love
for.
this.
And I know you love being on the spot. You're really quick. So being a teacher, you have to have that skill set.
I got it.
So education or healthcare, which system is going to be harder to fix?
Education.
One word that best describes Medicaid today.
Unpredictable.
Biggest misconception about the work that we do in in-home supportive care.
Okay, ask that question again.
Biggest misconception about in-home care.
The intensity of the work.
Policy you wish more people understood.
Medicaid. 100%.
Workforce issue that keeps you up at night.
As I said before, the burnout. We're gonna build this pipeline, and then if we burn people out faster than we're building the pipeline, that math doesn't work.
It definitely doesn't work. Innovation you're most excited about right now.
Can I take the word excited about off? Innovation in general, I hope I am alive long enough to see AI improve the healthcare delivery system the way everybody's talking about it improve. I'm scared of it right now a little bit. I'm interested and fascinated by it. I want to see it deliver the promises that it's talking about.
I love it.
Yeah.
Leadership trait you value most.
Authenticity, 100%.
Best advice you've ever received.
Best advice I've ever received. I think show up as the best version of yourself and don't try to be anybody else other than yourself.
Oh, I love that. What gives you the most optimism about healthcare's future?
The innovations that I see today added to the research that's happening today, the new technology innovations today. I always joke that, is it able to cure cancer or cure Alzheimer's? And that's always been an aspirational joke, but I think it's going to be possible. I just hope it's in our lifetime.
So do I. One thing Arizona must get right for aging well.
I would absolutely say, and it's just probably close to home, is this caregiver situation. We have to figure out how we support our loved ones in the twilight of their life.
100%.
And if we don't come together as a community and do that, there will just be tragedy after tragedy after tragedy. So I really hope Arizona's always been at the leading edge and the best in class when it comes to Medicaid and especially around helping people age at home. I am worried that it's becoming harder and harder to do that. And I don't want to lose all the groundwork that we've put in place up to this point. So what do we do with those that are in those twilights of their year? That's what I want Arizona to get right.
I so appreciate you answering in the way you did, because that's the world that we live in. And, it's really scary.
It is.
Because I get an opportunity to sit in kitchens, which is usually the central nervous system of a household, the kitchen.
The kitchen.
And if it's not the kitchen, it's the family room.
Exactly.
And when we sit down and have this very thoughtful conversation about caregiving, and it comes to the cost.
Yeah.
And by the way, since you and I were last on the radio almost 6 years ago, the cost of care, privately funded, is literally nearly doubled. And what's interesting enough is that most people don't understand that Medicare does not pay for it.
Right, Medicare. We haven't even talked about Medicare today.
Medicare does
Right.
not pay for it. There are 4 payer sources. It's private funds.
Right.
Sometimes we call it family funded because people don't have the funds.
Right.
long-term care insurance, which maybe 2 or 3% of our population was smart enough to buy.
And if it'll even cover enough for what you need.
Exactly. Medicaid or VA benefits.
Yep.
There are no other safety nets. So we sit here and talk about caregivers.
Right.
And Rosalind Carter, former first lady.
Yes.
She said there were
a distant ninth cousin, I will have you know, Jimmy Carter, to my husband. My mom did the ancestry work.
There you go.
Yes.
Maybe you got left something when.
No.
Darn.
No.
Darn. But here she was very outspoken about it. She had the Caregiver Institute, the Rosalind Carter Caregiver Institute that she created.
Beautiful
that was around for like 30, 40 years. 4 types of caregivers. There are those that were, there are those that are, there are those that are going to be, and there are those that are going to need it.
Yeah.
So we're all around this.
Right.
We all know that caregiving is going to be an obstacle.
That's exactly
And it's one we
right.
got to solve. So thank you so much for bringing that up.
My pleasure.
So Heather, is there a question I have not asked, or is there something you would like to share with our listeners as we get ready to close our first true podcast that we've had together, our 5th appearance, by the way.
5th appearance.
You might get the key to the podcast studio.
Oh yeah, when do I get the what's the jacket they give on Saturday Night Live?
I don't know which one it is. I always think of the green jacket
or
of the
Masters. Or the green jacket of the Masters, yes. I will say this. This has been a real joy and a pleasure to be able to sit down and tie so many corners of my life together in a way that hopefully makes my story not only just understandable to those that I work with and those that may be listening, those that my friends, family, and colleagues and community, but also I hope people found something in my story that inspired them. You asked me a question about, what inspires me about the future. I consider myself, and maybe you've heard this term, multi-passionate. Like, tomorrow, do I just open up a yoga studio? Like, the days of just doing one thing and retiring at 30 years with a gold watch, that's over. I live a multi-passionate life. I'm a wife. I'm a mother to my now 24-year-old daughter who is thriving and fully launched. Well,
I love hearing about
95% launched. I'm a caregiver to my mom. I work full time. I have my own passions and interests that I'm trying to pursue. I am not perfect. I hope that people realize that there are so many things that they can do in this life, and that if they start looking at their life in a multi-passionate way, I think that's going to open up so many more opportunities and maybe take some of the pressure off of the one lane that they are in, whether that be their job, their home, their family. Having these multi-passionate paths in your life, I think, is just what really has opened up this life to me. And I'm not perfect by any means, and I get exhausted, and I too want to figure out how to stay asleep at 3 o'clock in the morning, but I'm working on it just like you. And if everybody can see that authenticity and the pain points that I still experience in my personal life, maybe they can learn something that I'm doing, or I can learn from them. I just think that's what this world is really craving right now, that authenticity and showing up.
Well, I love that. And I asked you the question about how you became CEO.
Yeah.
And I did that in a way because you've had an extraordinary career.
Yeah.
You went from, selling air to the Suns to doing real estate, and to what you shared with before. You could have said, this is who I am. And,
right.
And you could have stayed in those roles. But you were looking for growth. You were looking to learn more. You were looking to broaden your horizons. I mean, I don't understand why you went down the political rat hole, but and I will tell you, I've been asked a couple times to run for one of our state offices, and I'm like, no, I'm not interested in that. But you chose
You'd
that.
make a great lawmaker.
But you chose that.
Right.
What did it do? It opened up the world to you.
It did.
And you learned so much. You're a continuous learner. You
Absolutely.
inspire me. You inspire others. It's just so great to reconnect with you, Heather. And then now in this new role that you're in, it's not so new. You've been doing it for what, about a year and a half now?
About a year and a half, which time has flown like that. I still feel like a newbie, though. I mean, I bring my own unique talents and experiences to this role related to Medicaid, but I never have paid claims. I've never worked the actual computer system to pay claims, but I trust and inspire and believe in my team who is doing that work. So if you're thinking about doing something in your life and you have I have a passion for Medicaid. I call myself a Medicaid evangelist. That's how I ended up in this role.
I love it.
Like, you don't need every piece of the puzzle put together before you take that leap into that next chapter of whatever it is. You network, you meet people, you talk to people, you put it out there in the universe, and you can manifest it.
You have 200,000 lives you're responsible
Yes.
for. How many employees do you work for you?
So in our segment, which is what would be the division that runs the Medicaid line of business, so just under 500, with almost about another 200 in what's called shared services. So yeah,
you got a big job.
It is a privilege to be in this role. And I am inspired every day when I show up to work and I see people just as passionate about serving the Medicaid population as I am. It keeps my passion alive, because it can be hard. I mean, it can be, it can be a grind. And when you hear in the news all of the things that are coming down the highway for Medicaid, it can be scary. I will tell you this one story if we have time.
We have time.
Working with people who have many times spent their entire career working in a Medicaid plan, and hearing what was being debated when they were debating the One Big Beautiful Bill, HR 1, whatever you want to name the bill. BBB. They had lots of questions themselves.
Right.
So one Friday, I scheduled a meeting, and I said, if anybody has any questions about what's happening politically with Medicaid, we scheduled it on a Friday at 3:00. And I'm thinking maybe 20 people will show up. I'm asking my team, I said, how many people have RSVP'd? And we're just going to have a conversation. I had 270 employees show up. People are craving information. Yeah. They are craving answers to questions that may be keeping them up at night. And so the more gets back to that first role that we talked about. I think of my day in and day out, I think of myself as a teacher more than anything else. And so if I can help teach people about what's really happening, teach them tricks to be successful in their own life, to regulate their nervous system, how to help support their loved one if they end up in a caregiver role, how to do yoga. I mean, that's what it's all about. That's what it's all about.
100%. And you need to do self-care. Right. Because you're caring for your mom. And make sure you take that time to do that.
I'm trying.
Because it's not easy. Every
day.
Heather Carter, so great to have you back on Health Futures.
Yes.
We'll definitely have you back again.
Okay.
We're not going to wait almost 6 years.
No.
This is your 5th appearance, but it took 6 years to get you back on. So I'm really excited to have you back on.
My pleasure.
Happy New Year. I hope the holidays were really good to you.
Yes.
And I'm just so excited to hear what JC's doing.
Absolutely.
She's lighting the world on fire.
She's lighting we probably shouldn't say fire because she's in emergency management.
In California.
In California. So she's doing amazing things in California. So it's just so fun to watch her start her professional career as well.
Well, thank you for joining us. And thank you, your Health Futures listeners. Thank you for joining us here today. Make it a great day. Have a great week.
Absolutely. Happy New Year.
And we'll be back next week.
Absolutely.
Take care.
Bye-bye.
Thanks for listening to Health Futures, Taking Stock in You. I'm Bob Roth, reminding you that living well isn't just about years, it's about the quality of life and connections. Follow and share the show, and join us next time for more on how to live a longer, healthier, and happier life.